Double A. Okay, go live ready. 5 minutes. Okay, share on your personal profile.
Wait, how to
Go to you. Double A. Okay. Weird, right? Hi, Divaga.
Hey, how come you can see people?
You need to go to the phone and then check. Go to our page, Facebook page. Hi,
Okay.
Divaga. How are you, my brother? Hi, May. May is here. Wait, hi. Hello. Hi, Miss Lee. Hi, Terrence. Terrence is here. Okay, we just give maybe 5 minutes for people to come in, and then we just say hi to them. Yeah. Hi, Sin. Sin is here. Sin is a nutritionist.
Oh,
Hello.
hi.
Oh, May. Oh, the.
Yeah. Your
Okay,
client.
now only I saw.
Okay, so far we have 11 people. Hi, Adrian. Adrian just came. Adrian just start watching with us.
How come today I can't see people?
You
Yeah,
can't see
like me too.
Yeah.
Oh,
That day
hi,
I was-
Nurul Huda.
you can see
Hi.
already.
Hi, everyone. Oh,
Hi,
hi,
Miss Tan.
everything.
Miss Tan is my teacher, my primary school teacher.
Oh,
Hi, Vivian.
cool.
Vivian say hello. Adrian say hello.
I think the connection is different.
So far we have 17 people, 18 people are watching us. All right, just let people to come in, and then after that we will just enter our topic. Three minutes. We have another 1 minute. After 1 minute, we will just go in. We will just deep dive into our topic. Our today's topic is low back pain and physiotherapy. Yeah, my primary school teacher. Hi, Sin.
Sin is the nutritionist, right?
Yes.
Hi, Rizwan Abu
Melissa.
Bakar.
Oh, really? Oh. Okay, probably I'm watching from my own personal profile, so I can only see my friends. So let's see. I go to the.
Hi, Thomas
Okay.
Ng.
Hi, Thomas. Hi,
Thomas is my junior. Hi, Mr. Ng.
Bye, Mr. Ng.
Selamat berpuasa. Thank you. How are you, Mr. Ng? Mr. Ng is my patient's father.
Ah, okay. All right, another 30 seconds. Okay, you can see the time is 4 minutes 26. After that, we're going to enter our topic.
I like somebody ask you fighting.
Oh,
June.
hi. June is my secondary school classmate. Yes, thanks, June. Wayne June, I think his name is Wayne June. Yeah. Okay, so we shall start our topic. Yeah. So before we talk about low back pain, let me introduce myself. I am Alex. I'm the today's host. Welcome to our To You and Physio Wellness community. This is our Facebook page, and today's I'm interviewing two guests. Let me introduce this Miss Husna and also Miss Rachel. All right. So Miss Husna, can you just introduce yourself to our audience? Where you work now, last time where you graduated, and also your current
I feel like I'm
position.
Mr. Famous. You want to know more about me? Hi everyone, I'm Husna. I'm a physiotherapist. Currently, I'm working with one of the private university as a specialist. The designation as a specialist, but it's like a clinical instructor. We do teaching on hospital base, so more on practical. Previously, I'm working in the WQ Park. Before that is with Gleneagles. Gleneagles for 6 years, WQ Park for 3 years. And then I'm doing on my own as a freelancer, then joined with a private university. Hi
Oh,
everyone.
where you graduated?
I'm graduated from UKM on
Hmm.
2010. Don't calculate my
Wow.
age.
Okay. Then okay, now let me introduce another guest. Her name is Rachel. Hi, Rachel. Can you tell us
Hi.
your yeah,
Hi everyone,
introduction?
my name is Rachel and I'm a physiotherapist too. I started working in KLSMC, Kuala Lumpur Sport Medical Center Hospital in Damansara Heights for like few years. Then after that, I'm joining to a center where it's collaboration with Olympic Malaysia. Then
Hmm.
after that, I'm currently doing by myself
Hmm.
as a freelance physio.
Hi,
Yeah.
Lily is here. Hi, Kasuri. So, for those we
Hi
have no chance to
Kelly.
say hi to you all because we are going to we're going to focus on our topic. So, yeah. Now, okay, we talk about this after we introduce our guests. Now, let us talk about today our topic, low back pain. Okay, low back pain. We know there's is a very general term. It's a very broad, big topic. So we are not today. I will just draw a boundary. I'm going to draw a line. We are not going to talk about the International Association study of pain, the definition of the pain. We are not going to talk about that because we have because when people say, oh, pain, low back pain, maybe you are having a fentanyl pain, your neuropathic pain, nerve pain. We are not going to touch on that. Today, we will just talk about the simple back pain, the daily activities. Example, when you lift up things, you suddenly got a back pain, or maybe when you get up from the in the morning when you get up from the bed, suddenly you got a back pain. This kind of back pain, today we are going to talk about that. All right, keep it simple. Then number two, we are not going to touch about the special cases that related to red flags. Example, if let's say you have back pain and suddenly you got a weakness of your muscle, you cannot control your bladder, you cannot pass urine. We also not going to touch the serious cases. Yeah. All right. Now let's deep dive into our low back pain, the simple cases. We talk about okay. Let's talk. Just ask Rachel. Rachel, what do you understand about the types of back pain, the classification of the back pain?
Hmm. So the classification of the back pain actually have two. One is acute, which is usually the pain is like less than 3 months. Then chronic usually is more than 3 months.
Hmm.
Then if like more definition will be like we have a non-mechanical back pain, and also we have some mechanical back pain.
Hmm.
Yeah.
Okay, just give it simple lah, yeah. And then through your experiences like in last time in KL SMC, right? What are the
Mm.
patients that you see a lot, and what are the common conditions, and what are their common complaints?
Okay, that's different. Like for example, in hospital setting, usually we'll see a lot of acute cases.
Acute.
Definitely also a bit chronic, but currently I'm now more on like freelance. So usually the patient that I've seen is usually more on the chronic side. So the
Mm,
treatment approach definitely is different as well.
mm, mm, mm.
Yeah,
So
because yep.
So you're saying that acute case like just happened, the management is different, and the chronic pain, the management also different, right? Slightly different, right?
Slightly different because how to say the case that I see in the chronic cases usually is a bit complicated because sometimes it's not just about the back itself. It can be other things as well.
Cool.
But usually people won't come, like especially chronic case lah. People won't come to see me with how to say back issue. They usually come with complicated things like associated with neck pain as well. Some is also knee. Yeah, it's more like a combination.
Combination cases lah. All right,
Yeah.
right. Like Husna, what about you? When you're in hospital last time, what kind of experiences that you see those?
Usually, first time when I was in Gleneagles Hospital, in hospital base, always have acute back pain. So we treated the acute one, less than 3 months. But we as a good physiotherapist, usually within the 6 to 12 session, the patient get better. So it not past the chronic stage. We treat it at the acute stage and give awareness to patients. So patient is getting better and aware of the posture, aware of which muscles to strengthen. So they are getting better. Same as W people also, most of my cases is acute back pain instead of chronic.
Okay, so we talk about when we talk about low back pain and also the physiotherapy role, what do you think about what can physiotherapy do and what are the goals for low back pain? We start from Rachel. So
Okay.
in your assessment and your treatment, what do you do for a patient who has low back pain?
So to be honest when I was a bit younger that time, definitely we have to follow protocol, right? We will do whatever that we've been taught in school, like a really manner proper procedure from the assessment part.
Correct.
You need to ask all the patient history part. But as I'm getting older, the more people I see, then I start to realize that you need to know your patient well. I mean, know my patient well, meaning that since when he start to walk from outside to see you, or you enter to the house to see themselves, you have to observe from head to toe, meaning that including the person presentation to you, like what kind of character the patient is. Because I do realize some patient, they tend to tense up easily. So for me, I also not down in my notes. Then I need to know that when the patient has this kind of like presentation, then what I need to really looking at. So usually I will, for back cases or not just back cases, I will see their breathing first. This is the way how I do it. Different physio, they have their own different style, right?
Correct,
So my style is usually I will see, is it this patient is more anxious, or how's the breathing pattern like? How the way he talked to me. Yeah, because for me, as a physio, right, because we do the things is actually the same. Like if let's say you do manipulation, I also do manipulation. But if we want to make sure the patient complies to our treatment approach, or be able to successfully treat them much more better, treat them holistically. I would prefer to say this as a holistic approach. That means that you have to see the whole general things instead of just based on what you assess them or treat them based on whatever you examine.
Yeah, like the patient come to you with a diagnosis of back pain, it's not necessary for you to treat the back, like assess the back. You have to assess from head to toe, everything.
Yes, true. So I agree with Rachel, because when we're doing the treatment, normally it's very mechanical, like a technician, we are fixing a car. We don't treat human as a human. We treat them like a car, and this is a part that we need to do. We just do treatment on that. We do ultrasound, we do hot pack without interacting with them. So I think this is very important for that, like especially building a rapport, talk to them as a human. Yeah. All right. So Husna, come to your turn. Do you what is your the I think you have seen those people who has muscle pain, right? Like a trigger point issues. Then what do you do with them? Yeah.
Okay, most of my back pain patients, they are because of their posture, ergonomic. Usually they are bankers, and then some of
Bankers.
them bankers. And now because of they are working from home, they have a lot of complaint of back pain because they
Yes,
say
I
they, right, you receive the same complaint. They
correct.
say because they are like most of the time in front of the computer, and then somehow it's Ramadan for me, for us, a lot of
Mhm.
women out there have a lot of things to cook. We need to cook every day different things, and then we don't cook one thing only. One dishes we cook like kuih lah, itulah, inilah. So they will complain of pain. After that, do work from home, do in front of the computer, and then go and cook. They say like sakit belakang lah, macam mana nak buat? But now we cannot. We know that it is muscle spasm is there, but we cannot release that for them. We can teach them stretching. Most of my
Ah,
patient is because of the spasm. So we need to relax them, ask them to use a hot pack. But if it like maybe if it is acute and still swollen, you can ask them to put a ice bag and then do some
mhm,
stretching, strengthen awareness, something like that. And
mhm.
if you are available with them, we can do release. I do believe that MFR and STM is very good for patients.
Oh, MFR is like a so-called like massage, right? Like a
Yeah, it's
release.
like it's a release for as a physio we call as a myofascial release, but as a patient no layman they will say like massage. So they will ask you, can you help me to massage here? You should be proud,
Oh.
right? With our handling skill.
Using the MFR, yeah, yeah, it's awesome, man. It's I tried before. Last time when I was still in the hospital, my colleague, he's damn good, man. Doing the MFR for me, just feel instant relief.
And
Yeah,
then
for
patient
back
will
pain.
feel addictive with that. Patient will come to you, can I have MFR? Can I have STM?
Right, they get addicted, right, because it feels so nice. So to talk about this back pain, okay. Yeah, remember I told you just now. Last time I was still in the hospital working, I also had experienced some back pain. So it means physio also human. Physio also has back pain, develop back pain. So today we are going to talk about. Now we're going to talk about our own pain stories, our own pain experiences. So probably we can start from Husna. Maybe Husna can talk about your own.
Because I look so old, so I have a lot of back pain stories.
No, no, I believe everyone also has this. It's like a bad thing is like a common flu, like a cold. Once in a while you might get it.
Correct.
Yeah, yeah.
As a
So yeah,
physio, we also have back pain. That's
yes,
true.
yes, yes.
As like doctor also we get MC, same as us. Even though we teach patient how to strengthen your core, how to make sure your body is straight, everything awareness, but we do sometimes to have a back pain. My
Mm,
recent back pain is during end of last year when I just recently joined a private university. My nature of work before this is like as a physio we walk a lot, and then we do a lot of activity in standing, in sitting, not in one position only. But then when I joined the private uni, I have to sit for quite some time, which is from 8 to 5, and it
mhm.
is I'm not used with that environment, with that nature of working. So at the beginning, at the like first 2 weeks, I start to feel a back pain. It's because of
Mm.
the environment factor causing me to have a back pain. Even though we have a physio, we do strengthen, we do stretching, but sometimes the environment causing us to have the back pain. Why I have the back pain during that time is because my height is tall for Asian height,
Okay, you mean okay.
but our chair, our desk, everything is I think is not according to Asian height. Is according to the European US height maybe. So that's why it
Okay,
causing me pain. The ergonomics not ergonomic for me.
okay.
The
So
environment.
how do you deal with the economic parts? Okay, economic is means like a work stress, right? So
Mm.
like a environment example, the table height, the laptop height, the mouse, the
The
design
chair
of the.
height,
Mm,
everything. Okay, at the beginning when I just joined, my workstation is the desktop and the screen is on my right side. right side of the table. It's a table and then it's on right side. So my chair, I have to turn and then I have to use mouse on my right hand because I'm right-handed, and then it is not supported. My elbow is not supported. So I start to feel pain over my back, upper back, and then after maybe 4 to 5 days, start trigger going down, radiating to my lower back, and then start to go to my pelvic area. So after that, I was thinking like maybe it's because of my elbow. So I start to support my elbow. But still, because I'm turning, like 15 degrees turn, it causing back strain still. So what I do, I change the desktop to really in front of me, and then I make sure my elbow is supported. And then my chair, after that, is improved on my upper back, but my lower back is still having the pain. So what I did is I adjust my chair. I need to put support on my behind of my back with a pillow, and then put a lower stool underneath. Lower stool
Lower
for my
stool
leg, the support.
under your legs.
For my leg, the support. So
After
I put my
that,
feet there.
after
After
that,
that, I
the
feel
back pain
good.
is- Ah,
Because before that, I keep on doing stretching and strengthening. I feel like I'm still having back pain. So I said like, oh, maybe the environment is causing the stress on me. So I change the environment, so I feel good. I feel better. So that is what I believe. For the person who are working from home now, they don't have a proper workstation. That's why they start to have the pain over the upper back, pain over the lower back, and then start to feel headache and everything.
yeah, it shows that the importance of the economic, and also the how our body adapt to the working position. Yeah. Okay, nice. Okay, then we okay, now it's Rachel's turn. Can Rachel talk about your recent pain stories or your experiences and how you deal with it?
Okay, so actually for me lah, there's no perfect posture. Okay, there's no perfect posture. So for example, you tend to ask your patient or even myself or sit straight, because a lot of when I instruct or sometimes tell people to say sit straight, a lot of people will tend to like arching
Like
a
this,
lot on
right?
the back. Yes, over straight. So for me, there's no perfect, because sometimes you realize that if I lie on my sofa or I lie on my bed or certain position which like maybe slouch or I cross my leg. I think a lot of people like to cross the leg, right?
Cross leg, yes.
Then some for my style, I usually don't ask people to not crossing the leg,
Why? Yeah.
because my patient will cross, because when I'm asked my patient why do you like to cross your leg? Because I feel comfortable. So my advice for my patient is next time try to use another leg to cross it back.
To balance back, you mean?
Yes, instead of, because for me there's no like I mentioned, there's no perfect posture. Because why? It is all about habit instead of posture. So if you can't change your habit, so try to change your environment. Like just now what Husna said, change the ergonomic. Because a lot of times that we like what I didn't tell about my pain. I tell about my patient pain because I saw so many cases. So that my patient usually say, oh Rachel, I have no choice. I really have to work in front of my computer for very long. I have a lot of conference call. Then how to adjust it? So for me, if let's say you are my patient, usually what will you do if you sit in front of computer too long? Do you think that
Usually,
putting
yeah, okay, I answer first.
mm,
Usually, my way is I will, instead of the body go towards the computer or handphone, I will usually bring the laptop or the phone close to me, and I will try to shift it to the horizontal level. Example, if let's say handphone, instead of looking down, I will try to lift it up at least horizontal. Sorry, can you see it? Okay, like this.
a bit, yeah, okay.
Okay. So I will just make it like this. I will watch whether the computer or the handphone. I'll try to leave it horizontal level. Okay, and then close to my body instead of my body go towards to the device. Okay, so everything is like an upright position, number one. Number two is how to say, I will try to discipline myself every maybe half an hour. I will stand up instead of maintaining the posture for too long. Maybe I do some pelvic movements just to keep my body moving.
Okay, I got few suggestions that I implement on myself because currently everyone is doing telehealth, right? Even
Yes.
we used to move around to treat our patient, we tend to looking at the
Correct.
computer for quite some time to consulting them. So actually, I got the gym ball. I sit on the gym ball instead of just a chair
Ah, that's a
because
good
when
idea.
you sit on the gym ball, you will tend to realize to engaging your core automatically.
Ah,
Yeah.
True, true.
And second thing, you try and see lah. Because I usually will try it on myself before I tell my patient. Because you will realize that like Daiso, they're selling those back support, right? For me, it
Daiso, yes.
doesn't. It doesn't really work for my condition. So because when we put the support, you realize that the main thing is our pelvic, our bone on our hip there is still sink there. So it still feel the pressure. So what I do, I ask my patient or my client to roll a towel to make sure you put underneath your the buttock. There's the two bone there. You just slightly sit on it, so your pelvic will tends to like roll a little bit in front.
Mm.
So instead
And then
of
give
your
you awareness also.
yes, because for me, if I will change, I will slightly change on the buttock part, the chair part.
chair part lah.
Yeah, definitely the elbow, everything is quite important now. The positioning. So for example, I got something to share with you guys.
What
Can.
is that?
Can.
Okay. So if you realize that if we sit in front of the desk, right, we tend to go much more forward to look at our
Yeah.
computer, right? So
Yes,
if
yes.
let's say we can incline, you can get this thing in many places lah. So this thing is something where you make your computer slanted a little bit. This thing.
Okay. So
You
you
can
put your
imagine, right?
laptop
Yeah.
on top.
Yes. On top, so your laptop will be slightly like inclined a bit, so you are not
Inclined
looking too front. Yes.
So you're not doing like this.
Yes.
Yeah.
Then after that, you'll test because when you start to look front, then your
Yeah,
hip
everything
definitely
will
will
start to be pain.
correct. And someone you will complain, oh, I have no time to exercise lah. I forgot lah. So sometimes we change a little bit of this kind of thing. It definitely helps. And another
And then,
fun thing,
and then one more, they will
Okay.
say the patient or my friend always said, I didn't do anything. I didn't do anything that harm my back. But actually, they are doing like this. You didn't notice. They don't
It's a
aware
habit
about.
lah. It's a habit lah. Yeah.
and recently because we use a lot of telehealth, I also bought myself this one.
What is telehealth, Rachel? Can you explain?
Wow.
Telehealth is like because now MCO, right? Everyone cannot see each other. We cannot in touch with each other, right? So
Okay.
telehealth is something where we actually use our internet, like Skype now. What we are doing this StreamYard. So we actually looking at our patient. Then we are monitoring. We are assessing them just by looking how is the condition like. Like we ask them to walk around and see to assess them. Then we consult them through online. Then we give advice. We monitoring them through online.
Online consultation.
How is the
Sorry?
feedback? How is the feedback using the?
Because so far my case there's one 90 years old auntie. Yeah, yeah, like
90 years
today,
old.
90 years old, yeah. But she's still very alert. So during this MCO, because she actually there's no stroke, it's just general weakness that she had pain, shoulder pain, knee pain, like old people issue lah. So because she can't really see well, so the children actually plug in the laptop in front of the TV because they say, oh, you watching TV too much now, you have to watch Rachel. So yeah.
Idea.
Yeah, so I was like exercising in front, like now that I'm exercising, so she's doing it, so I actually monitoring from far. This is telehealth. Wait, I haven't shown you. This thing is quite interesting.
What is this?
And this is a mouse.
Mouse.
You see?
Oh.
Yes.
Oh.
Okay. I'm not sponsored by this one, but I just want to share the goodness of this one, because mouse skin is very thin. We tend to use a lot and we typing a lot, so we tend to have a lot of people tend to complain. Oh, suddenly I got pain here, like radiating pain or be quite paternal. Yeah. So this thing actually is hold like this. You can see the position. It's quite ergonomic, but definitely is supported lah. It's supported,
Mhm.
and it's quite good for finger as well because the position is like this. Can you see?
Yeah, can. You're
So
keeping
Can
your
you
it's
wrist like this.
like this. So it's
Neutral
quite
position.
comfortable. Neutral
Mm.
position. This. Mm.
Mm.
So so during this MCO period, I also try to find something is good for us lah. Instead of like, because since we're doing a lot of telehealth, right? So
Yeah.
sitting on gym ball, changing a lot of like environment things will be helping as well.
Okay. Now, can we look at we're going to look at the comments because some of our audience they are actually asking some question like this. Vapo Rapid, I think is Husna's friend. Yeah, maybe you can answer that. I have been very busy making kueh for Hari Raya, and it caused my back pain. It hurts a lot. What to do? Yeah. Well,
Okay, stretching only is not enough.
can do some
Stretching
more.
does help. Stretching does help because it make your the muscle will are tight in a lengthened position. But then stretching only is not enough. You have to strengthen. And then one more thing, because you do a kueh for Hari Raya, that cause you back pain. So you know what trigger you. It's not that I ask you to stop straight away do kueh. You can do kueh, but you need to have a rest in between. And then at the same time, you do stretching and then strengthen also. If you want to know how to strengthen, do DM us. We're going to teach you strengthen based on your condition.
Okay,
Yeah, we
message
have a
us.
telehealth with Rachel also.
Rachel can help now.
Rachel
Okay,
can help.
okay.
I hope that answer you, Vaporoid. MY? MY
Okay.
stand for Malaysia, maybe?
Okay. So now I talk about my stories lah. Yeah. So talk about for my own experience. Whatever you do, if you are doing it for a prolonged position, example, if you are sitting slouching too long, it's always not a good thing. Whether you are standing too long, you are sitting too long, you are lying too long, also not a good thing, because
Correct.
whatever you do, okay, example, even a good things, I give an example, like a vitamin C, okay, supplement. Okay, I want to ask audience, do you know what is the normal daily dosage for us every day? You mean like you go pharmacy, you can buy like 500 mg, 1000 mg, 2000 mg vitamin C, right? So do you know that every day what is the requirement, just a normal requirement for us? Yeah, maybe we can just ask our audience and then can just give us some maybe some answer. Then later we will show. Don't Google, yeah. I know everyone are nowadays. When we ask question, Google find answer. Maybe you can just guess a little bit. What are the normal dosage? Is it like 500 or is it like 1000? Yeah, you can guess. Can ask our audience.
1,000, because every time we buy the vitamin C, it written 1,000.
Correct. 1,500.
Mm.
My answer is 500.
Anyone can guess? Just guess. Yeah. What are the numbers? Just agak-agak lah.
What if they got correct? Any prizes for them?
Yeah,
It depends. Yeah. Maybe we can just give a one session of telehealth.
Ah.
Anyone guess? Like just the
1,000.
normal dosage, not too much, not too little. That dosage is good enough. It's good enough for us.
Somebody
1,000?
answer 1,000.
1,000.
What else? 2,000. Wow. Okay.
Wow, 2,000. 3,000? Don't have? It's like bidding. I love you, 2,000.
Yeah. For vitamin C. Vitamin C. Yeah, around 1,500 to 2,000 mg, right?
Mm-hmm.
What else? We just leave one more answer for the next audience. You can just guess what is the normal, just the minimum or just a normal standard dosage. If you take that dosage, it's good enough for our body. 500 mg. Okay, now I'm going to review the answer. Okay, the answer is just between 70 to 80.
One person say less than 100 mg.
Yes.
How Peng
Yeah,
Hong.
it's 70 to 80 mg only. Okay, you probably will.
70
Okay,
to 80.
this answer is actually I got consulted a nutritionist and also dietitian. Nutritionist I want to credit to Yi Qian, and the other one is a nutritionist. My friend Sim, teacher Sim lah, his name. So it's probably just like say 70 to 80 mg is good enough for our body. Of course, you can take more than that, but if you overtake it, whatever you take it inside, you will just remove. Your body will just remove.
Can I ask a question?
Yes.
So what food actually contains 70 to 80 mg
Okay.
of?
My friend is actually telling me this. You can take the vitamin C's, okay? You can take the supplements. It's okay to take that. Just there is a difference between you are taking the vitamin C and the natural fruits. Ideally, is you take different type of fruits like apple, oranges, kiwi. All of the fruits they not only contain vitamin C, they also contain other micronutrients. So for them is you can take both, of course. You can take only vitamin C supplement is okay. You can take natural fruits also okay. Yeah. So
Okay.
these are the answer that I got it from my friend lah. Yeah.
Mm. So
So
people
suggested
try not to eat too much during
supplement?
MCO period. I should
okay.
show to
So
my mom, you know.
okay. The reason why I bring out this why take even the good things if you take too much also not a good thing is because okay I said one thing if you have this thing it's good, it's a good thing like money. Okay, you have more money, it's a good thing. All right. Yeah. Then okay, then talk about the sitting too long, slouching too long is always not a good thing. Yeah, and I always believe that our body, our human body, is designed to move. Okay, whenever you're sitting too long, if you think that okay, sitting half an hour, you don't feel comfortable with the back, it's time to stand up. It's time to do some stretching, move a bit, because movement is lotion. This lotion is actually help us to mobilize, to circulate our blood, to help to keep our body healthy. Yeah. So now we just go back to our audience. Let's see, got any other questions regarding low back pain? Okay. This one is I've been taking 1000 mg every day, but the back pain attack me. That consumed the. Oh, this one I
You can
think is
continue or not?
I, I don't think it's really. I think it's okay to take, but I think it's better you consult dietitian or nutritionist. But it shouldn't bring any harm to our body, lah. Yeah, yeah. As long as with the right dosage, I think it shouldn't be any problem, lah. Okay, Rachel, can you tell us about your recent back pain and how you recovered? Because I believe physio also got some back pain issue.
Okay,
Yeah.
my back pain. Okay, so my back pain is because like I mentioned just now, because during this MCO period, I sitting too long, like learning a lot of things that from internet, how to do it. So yeah, definitely it's become a habit that I sitting too long. I like to cross my leg, so so definitely I do some exercise, but sometimes the exercise takes times. So what I think important for me is I keep on changing position now. Like for example, I put my 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 water bottle a bit further, so I need to like stay hydrated, so I need to walk. I need to get up and walk around. Yeah, then after that, like I get up myself, then I try to sweep the floor. I try to do something. Yeah, I make it like that instead of I keep on I clean the room the whole day. I don't do that. Okay, I in front of computer, then after that I get up, then I sweep the floor, then I go back my computer back again, then I stand up, I mop the floor, something like that. Yeah, because a lot of people, like even my own client telling me, Rachel, I'm doing exercise, I'm mopping floor every day, I do the housework, I'm also sweating, I'm also exercise. So for me, And also for the answer is actually doing housework or doing all those things is a labor work. It's not really an exercise. Because why? Even though when you do exercise, right, a lot of people tends to forget to breathing. And maybe the emotion is not so happy. You realize you compare two person. Person A is a very happy person. I mean, the person is quite happy and she do the house chore actually is more, how to say, is without force, means that she's willing to do it. And the second B, she does not like to do housework, but you force her to do it. So which type A or type B person actually tends to get pain more?
B.
The type B,
B, right?
is related.
Because yes, because pain is not just because, oh, I got injured, then that's the pain. Because a lot of pain actually come from our
Emotions
brain,
or
yes,
brain.
our emotion as well. Correct.
It's related also. Yeah.
Yeah. So for me, like just now what I say, I try to in between I keep on doing something to stay active, to move more and move smart, I will say. Like for example, exercise. I also have patients who actually love exercise. They're triathlon, they're runners, but they are not really, how to say, they think that, oh, I do HITT is actually an exercise for them, but they are not really focused on, let's say I have some pain that I need to focus on that specific muscles, because their condition is more like wear and tear. Then I need to work out on specific, how to say, exercise to help to build up the strength to prevent wear and tear. Yeah. And I'm out of topic.
No, it's not our topic. Okay, now let's look at our live comments from our audience. Hey guys, what is your experience with low back pain patient who is active in gym workout?
I think
Lily.
this one Alex can answer.
Okay, so Lily, I think the question is a bit general. It's good to ask about more specific questions, but I will just give you some guideline. Example, it depends on those people who are doing gym workout. When you talk about gym workout, is this person is doing cardio more, or is it this person is doing more like a weight training? Because different people, different low back pain, different management. Yeah.
Mm.
But so if you're talking about the weight training, I would suggest if you are just a beginner, you need to work on your movement pattern. Make sure you lift lighter. Start from light weights, then slowly progress. Work on your movements, the form, your gym. When you carry the weights, make sure your form is correct, lah. Yeah. Okay. I hope that I answer your question, Lily. Okay. This the other comment. Xiaoping Hong. Last time when I told my doctor I was doing household exercise, I mean housework at home. He said I was only doing exercise with my hands. All right. Okay. I got one. I got my. Okay. I will just tell my experience like yeah. Okay. Usually, how when doctors say you're doing exercise with your only my hands. Okay. We need to differentiate the exercise, the real exercise, what is the physiological part changes to our body. Example, I gave example very easy. When you're doing the cardio, when you're doing running, you actually raise your heart rate. Your heart rate will actually increase, okay, which is different from your housework. You know, housework is unless when you're doing housework, then you feel your heart beat very fast, lah. Then it's different type of thing. But usually when you're doing housework, we are actually uh, mopping. You don't really raise your heart rate, right? So it actually is slightly different. The physiological part is a bit different. Yeah. Okay.
But
So
it doesn't mean that you need to stop the housework. You see, if you do, you see mobile.
Yes.
At least you do something instead of you lying
yeah,
down, sitting only.
yes. If you can do exercise, of course you can do some like cardio exercise and weight exercise. If you don't have time to do that, then do something is better than do nothing.
Yes, correct.
Yeah. So Wisna, this next question is: what are the home advice, home management for patient who has acute low back pain, especially during MCO? What are the things that they can do at home to ease the pain?
Cute.
Acute, yeah.
Okay, at the beginning, the person who are having back pain need to know what movement does trigger the pain.
Mm-hmm.
They need to know the answer first. If they can't give us that answer, it's a bit difficult for us to figure out how does the back pain happen. If they know the answer, as a physio, I will tell them, know what trigger your pain. You still can do that type of movement, but do lesser. You can do like 5 minutes and then change position. 5 minutes, change position. Don't do that one like for 30 minutes, 1 hour or 5 hours straight. And then the rest, we need to check your muscle. You can do stretching, but this one is a bit general. If we say to
Yes.
you, do stretching here, stretching there, but it's not suitable for you, it might harm you. So why not you DM us? We can do
Yeah.
specific exercise for you, Sandra.
All right. All right. All right. All right. So,
It's okay.
example.
Just ask
Yeah.
us. We can answer you personally. Don't worry.
Okay. Okay. So she's your friend, right? Okay. Okay. All right. All right. All right. So, when you talk about acute pain, for my understanding, is like early morning when you get up, suddenly you cannot move, you cannot stand, you cannot walk. This kind of acute attack. All right,
Mhm.
and that is very for those people who has that, like I myself, like 10 years ago, I remember that time I was feeling very nervous. I was feeling very anxious because I was thinking that what's wrong with my body. Is it am I getting a serious injury or not on my back? Because that time when I was still because that time I already know some physio things, right? Uh, that time my back pain is only happen at the center. It doesn't go
Mm.
down to my leg. It's not shooting pain. It's not radiating pain, but it's very severe on my back at the center. But I was also thinking, oh my God, am I having some serious issue? So I was so worried. But then one thing is I make sure that it's not a red flag. Yeah, one thing good
Mm.
about that is I do calm myself. Yeah, one thing is just enter at the back, and then I can still move my hand, I can still move my legs. Just that sometimes the pain just out of nowhere when I move pain. So what I do is I just rest myself a little bit, and then I move a little bit. I don't completely have a complete bed rest lah. All
Mm.
right. So okay, the question that I want to ask you all, okay, regarding complete bed rest. Okay, when you talk about back pain, you will often heard, oh, you have low back pain, or the doctor say you have to rest on the bed all the time, you cannot move at all, walk more, move more will worsen the pain. What do you think about this statement? Yeah, we would like to ask Rachel.
Well, completed bed
Complete bed rest.
rest. This one I will be disagree lah, because when you completed totally rest, there's no much of movement. Then I think that will be definitely harm to our body, right?
Mm, mm.
Yeah.
Like Husna, what about you? What do you think about this? The complete bed rest.
Okay. I will advise my patient to have a rest, but not complete bed rest. My definition
Mm,
of rest is something that trigger you pain. You need to understand what is the movement, so
Yes.
you have to rest from that movement. But it's not total rest from that movement. You have to give your body some space with that movement. Like example, if sitting too long trigger your back pain, so maybe like after 15 minutes you have to go stand, walk around, then come back to your workstation. Not like totally cannot sit at all,
Mm.
something like
understand,
that.
understand. Because I believe that when we are having acute back pain, is actually our body is at a very sensitive state. So
True.
usually we will use pain management. So maybe sometimes you need to see doctor and then take some medication just to manage your pain a little bit. And then at the
Mm.
same time, you will usually see this kind of the management in hospital. So a doctor will prescribe some painkillers or some
Mm.
medicine, and then they will send patient for physio. And then the physio will teach them, okay, physio will identify what are the movement that they can do at that moment, what are the
Mm.
movement that can be avoided or minimized at that moment temporarily, and then slowly from there work on the movement, work on the muscle. All this is to so that to speed our recovery faster lah.
Yeah.
Yeah. So okay, now let's talk about this.
Question.
Yes.
I have one question. Some of my patient is asking, I have a low back pain. Can I take medication throughout the year, throughout my life? Because after I take the medication, the painkiller, I feel better.
What
That is
your
a common thing. Common thing that patients told
how
me.
do you answer them?
How?
If you want to have your kidney issue, then you take more.
What do you think, Usna? How do you?
Okay, for me, okay, you need to know what is your goal. At the beginning, when you are acute, when you come to us with severe pain, when your pain score is 8, 9, for sure I said go and take your medication. But then after with a physio, with the medication, the pain go to 5, I will ask them, can you stop first the medication and see how it goes with physio? If physio does help and then reduce your pain, why you need to take the medication?
And also,
Why
I
not
think,
you exercise? Because
sorry.
exercise is the key for you,
Restore.
for your physical body. It's a best medication is exercise.
Yes. The movement.
But then they will say, I am so lazy to do exercise.
Yeah.
So change your habit.
Change your habit. Yeah.
Change your
That's
habit.
why we
Like
go
I
through
like
And then
to cross my
one
leg.
more, they will add on. I cannot change. That is my environment. That is common excuse that I always get from my patients. Then I told them, it's okay, I know you like to see me. It's okay, just do whatever you do, then come to see me.
Yeah. This is like so-called like human I think human nature and human beings. Some people memang like they don't like to move, so that's why we need to help them, need to empower them to move and yeah. Okay, so any questions, Rachel, or any question from our audience? Yeah, just give maybe like one or two, maybe 3 questions or one or 2 questions regarding the low back pain. Yeah. Okay, now let's talk about this. If you don't have
Core.
questions, sorry,
We
Rachel?
can talk about the core. A lot of people like to sit up, right?
Okay, yeah, talk about core.
Sit up. Okay. Because I got a lot of patients also. They still like to do sit up, although sit up is not so encouraged, right?
Sit up. You mean
Sit up.
sit up too long also?
No, do the sit up exercise.
Oh, okay. I mean
To
the
build the
stomach
sit. Yes.
abs.
So actually, what is the understanding of core? Like how much of understanding of the core to the patient is actually very important.
Yes. How they engage their core. They will say they will do
Correct.
plank, they will do sit up.
Yes, correct. Because I got many clients, yeah, there was like, Rachel, I think my core is very strong. You see, I can do plank. So I say, okay, then I check on your plank. Then sometimes the buttock is lifting up too high, or their shoulder is not in a proper position. It's quite how to say, the core actually is not really engaged because they do not really understand how to really engage the core. So for me, usually I tell them, because I realize nowadays people tend to like chase about the numbers. They will really pay attention on how much I need to do, how many times I need to hold, is it I have to do morning and afternoon and evening, but on the next session, do you do exercise? I will lazy lah. But they tend to chase on the number that they are specific on. So usually tell my patient, you don't have to do a lot, you have to do it correctly. Like for example, I take a example of bridging. Okay, so bridging is like bridging is like you bend your knee in both 90 degrees, then you lift up your buttock, that kind of exercise. So when people do it, it seems like they are not really focused on the core to be flattened, the stomach or the back to be flattened to lift up the buttocks. But they straight away arch the back and lift up the buttock to help the buttock to move up. Then end up after they doing, how come my back is painful? It's another thing. Yes. So for me, that when patient really look into pain or exercise therapy, they really have to how to say, take note on the quality of the exercise that they're doing, like how to positioning when you do this, what you should feel instead of like, oh, I need to do 30 times, oh, then after tomorrow I have to do 50 times, then after another week I have to do 60 times. Instead of time or the quantity, we need to make sure that they also follow the quality lor. That's what my advice to people.
Yeah.
What do you
Move
think?
well, then only you move more. Something like
Move
that. Right? Make
smart.
sure you
Yes.
Mm,
Move
correct.
smart instead of move hard. Like for example, sit hard instead of, it's better that you sit smart. A lot of people tend to sit hard means that I arch my back. You see, I sit straight, I do my things, everything straight. After that, neck pain pula. But they need to know how to sit smart. Now we're going to the smart things, smartphone,
work
smart
smart,
everything.
work
Yes,
smart, move smart. Yeah, okay,
yes.
okay.
Exercise smart.
No people work hard anymore. No people sit hard anymore, right? Everything is going to move. Yeah, move
Yeah,
smart.
yeah. All right, all right. So okay, let's see. I got any other questions? If not, uh, we will just do the last question, which is our covered the last point, which is a take home message. What do you want to you want message that you want to let audience know? Yeah, maybe we start from who want to start first? Rachel or Rachel first lah. Start from Rachel. What are the take home messages that you would like people to bring back from this video, from this webinar, from this
Okay. So
live?
if you okay, for my message to my patient, if let's say you want to know whether you engage, you don't have to know that you are engaging your core properly or not. First of all, you need to know how you breathe properly or not. Okay, when you know how to breathe properly, then only increase your activity to move smart and not hard. Okay, so the first keyword is breathe properly. Then the second thing is try to move around to move smart instead of hard. That's all.
Understand.
For example, if I want to pick up things from the floor, instead of bending down, I can squat and pick up, right?
Okay.
Because a lot of people tend to, oh, I want to reach something near to me, then I just bend down my spine or my back to pick up things. Why not you try to squat a bit so that at the same time you also strengthen, how to say, to help you to strengthen your knee, your hip, instead of just pick up the things from the floor.
Yeah. Because sometimes, I understand that the movements can be different. In order to achieve to this goal, you want to pick up the things. You can use different way of. You can have different ways to achieve to reach your objective. Yeah. Okay. Husna, what is your take-home messages?
After you do the core strengthening, stretching, strengthen, whatever with what Rachel told you just now, you have to make sure during this MCO, those who are working from home, make sure you have an ergonomic place with you. Don't let the work from home causing you back pain. So you need to make sure whatever your workstation is suitable for you. Support your elbow, support your hand. Make sure you have a good backrest, have a good chair height, and a good workstation.
All
Then
right. All
can
right.
on same time stretching and strengthen and breathing exercise.
Breathing exercise. All right.
Yes,
All right.
breathing exercise is very important. Like what Rachel said just now, breathing exercise can make you feel better, calm yourself. Some of my friends say working from home is very hectic psychologically. So breathing
Oh,
exercise really can help you. Because most of my friends have kids, so they have to do all the houseworks and then taking care of the kids, masak, and then working from home. So it's a bit hectic for them. So just do a breathing exercise, simple exercise. It can help you feel better.
all right.
That's it.
Right. Okay. Guys, do you have any other questions? Rachel, you have Other questions or Husna? If you don't have, then we will just call it a
Day.
session. Yeah, we call it a day. Yeah.
Next
Okay.
week we have the stroke cases, right? Next week
Oh,
we are
yeah.
going to discuss more of the stroke.
Yes. So next, probably next Thursday, we're going to make an announcement. Maybe next Thursday, we're going to talk about stroke. And what are the management. So you can just wait for our announcement.
We have a special guest. Yeah.
Yeah, we also have one special guest who is a doctor. He will come here and then we will interview him. We will talk about this topic.
Yep.
All right. So thanks, Levan. Thanks, guys. So we call it a day. So we will see you guys. We'll see you next week. Thanks for joining our live, our Facebook live, our friends. Hi, Chandra. Thank you, everyone. Thank you, guys. Yeah.
Thanks, Chandra. Thanks, Condi. Thanks, Ira. Thanks, everyone.
It's the Chandra, right?
Chandra, yes,
Chandra.
yes. So see you guys next week. Okay, I'm going to end the live. Hi, thanks, Chandra.
Bye.
Okay, bye-bye.
Bye.
Be safe. Take care.